right, yeah. Thanks, Manshi. So just to set the structure for the discussion today, we'll try to contain the discussion within 1 hour because that's a time slot we have done for this one. Uh, towards the the Q&A window will be open throughout the session. So as a participants, feel free to post in your questions as we are progressing through the discussion. Just to maintain the continuity, we'll be taking up the Q&A towards the end of it. In between, we'll be having a few interacting polling questions. And at the end of the webinar, we'll have a short feedback form. So do provide us your feedback, which will definitely help us perform better and plan better for future sessions. And do stay with us till the end. We'll have few very special offerings for you. And just to start with, I'll just, with your due permission, I'll quickly introduce TechMint. So TechMint, we are an IT product development company and services company where we partner with various companies, organizations, and work with them as a technology partner to build application and technology platforms for them. We are an 8-year-old. I would rather say we are an 8-year young organization. We have got extensive experience working with different industries like healthcare, education, consumer internet, worked with all kinds of clients like startups, small, medium businesses, even enterprise clients as well. Some of the services that we offer at TechMint are like prototyping for startups, building MVC for them, UI UX design. We have worked with various companies in building like POC, like proof of concept for new technologies. On the enterprise side, we have done platform engineering, we have done product engineering, we have built enterprise applications, bespoke solutions for different companies. And our customers range pretty much across the globe. We have got customers coming from US, Europe, and India. So operating TechMint over the last 8 years, we have built our competencies more in terms of a scalable team, because the way we work with client, we're able to scale up as per the client requirements. We do understand in today's world, it's very important to be agile and cost effective. So we try to match with the fast changing world, technology world, by being agile and nimble. We have kind of developed our own expertise as a technology thought leader. And most important, we have been working as a successful technology partner and take the responsibility of technology function for the clients that we work with and try to make their business success in terms of technology. So that is what we do very quickly. That is what we do as TechMint. Now, I would like to introduce our esteemed panelists. So in the panel, we have James with us, who is joining in from California in the US. So quickly about James, he's a sought after technology expert and a visionary who has decades of experience working in the fusion of technology and business in the healthcare. He's currently working as a principal with a rapid growing company, Healthcare in Motion. He's played an instrumental role in ensuring the success of digital transformation for various healthcare institutions. And James is also a data science expert. Under his leadership, various startups have built innovative technology solutions for the healthcare applications or healthcare companies. And thank you, James, for joining us. We are honored.
Thanks for the warm welcome.
Yeah, thanks, James. And then we have Trip along with us. Trip is an executive coach and a technology thought leader. He has spent past 2 decades working with really large healthcare systems like Cleveland Clinic, Ohio Health. His team works with several technology partners on IoT solutions, artificial intelligence, bringing new solutions to healthcare market. He also works with early stage companies for developing applications in the emerging fields of nurse practitioners and telemedicine. Trip has also been instrumental in transforming healthcare in rural and remote communities. A very warm welcome to your Trip. Thanks for joining us. And it's great to have someone having a diverse experience like you for this discussion. And Trip is joining in from Ohio, US. And then we have Dr. Vikram joining in from India. Dr. Vikram, he is the founder and editor of Healthcare India, a think tank. He's passionate about building a futuristic model for healthcare in India. He's recently published a book, Your Own Health. I have personally read your book, Dr. Vikram, and thank you for sharing your insight in the book. Very helpful text, both in the context of managing personal health and identifying the opportunities in the healthcare domain. So definitely a worth read for anyone interested in either personal health or healthcare. Dr. Vikram serves on various industry committees on healthcare and has published papers on wide range of topics like patient care, patient experience, blockchain, and public health. His area's expertise lies in devising healthcare strategies, customer acquisition, go-to-market strategy, and healthcare public policy. Welcome, Dr. Vikram, and it is really wonderful to have an expert like you with us. And then we have a very special guest for this event. I would say very close friend, a mentor and a guide. So I know Gary since last 4 years, and every interaction with Gary, I have something to learn from him. Bit about Gary, he's a healthcare expert, charismatic leader, being in healthcare industry for almost more than 30 years, I would say. And last 20 years, he's been leading companies in the healthcare domain. Currently, Gary is CEO of Avio, which is one of the leading provider of managed care services to injured workers in a workers' compensation insurance domain. And Gary has been successfully implemented digital transformation in his business, and he was instrumental in turnaround of his business. Thank you, Gary, for joining us, and we are all looking forward to hear from your experience.
My pleasure, Manish.
Yep, thanks, Gary. So just to set the context, and then I would like to hear more from the panelists. But just to set the context on about the healthcare industry and how the scenario has been changing. So if you look at the healthcare industry, a lot has been changing, and especially the pandemic has accelerated the change in healthcare domain. And if you kind of look deeper, the change is so fast paced that it is not only creating new opportunities, but at the same time, it's kind of exposing fault lines in the existing systems. So for the companies, for the healthcare companies surviving in this digital age, it's become very important that they address the three core focus areas of quality, accessibility, and the cost. The couple of challenges which healthcare companies are currently facing in these three core areas are shortage of care workers, rising cost of care, poor patient experience, diagnostic error, and there's a kind of long list, kind of a long laundry list of it. But what we have seen, technology playing an important role in addressing some of this issue, and that is what going to be the centerpiece of this discussion today, that we'll try to understand from our panelists on how and if first of all, if yes, then how technology can help transform healthcare business and help care providers deliver more values and develop their own technology and digital roadmap. So that would be the kind of the context context for the discussion today. And if it's kind of draw a parallel, if you look at over the past few decades, technology in like various business verticals, we have seen the technology has changed the way the business has been connecting with the customers, and the dynamic participation of customers has been driving business success. So with that as the initial point, let's begin to first understand the most important person in the entire value chain, which is the patient or the consumer. So with this context, I would like to first ask Dr. Vikram. So we'd like to know from you, Dr. Vikram, how pandemic has changed patient needs and expectation, and what care provider must do to better serve the evolved patient need. And do you feel in today's changing world, it is right to call patient as consumers or customers?
Yeah, that's an excellent question. It's a very long question, but it's, I think, the most relevant one today. So though I have worked in healthcare systems on 3 continents, right, in the US, in the UK with NHS, and obviously in India, I'm going to base most of my references back to India because that's the system I'm most familiar with, and that's the country I serve. So first and foremost, Manish, I saw in your chart, you said poor patient experience, right? Or the patient experience is not that great. One of the biggest changes that has happened in healthcare, and it's common across the world because it's a global trend, is that the patient has started asking for better services from his healthcare provider. And the blame for that experience squarely lies at the industries like technology and consumer goods. I'll give you a good example. Amazon has spoiled us in India so much that you order something, you know it's going to get there, you know when it's going to get there, they keep sending you notifications. That in India now, if Amazon is able to deliver that service, the question is, why can't my care provider deliver me that service? So if the care provider builds a mobile app, the benchmark is Amazon. It's not what the government was providing. It's not what the earlier service providers were providing. So you see a very interesting category of users. And these are smart users, these are e-commerce users, these are folks who've traveled abroad. And this category has morphed from being the patient to the consumer. Because their expectation is my healthcare provider should give me the same quality of service that other consumer goods companies are giving me. Whether it's Amazon is just an example, or Uber, Ola, so many of the others. So in a way, the patient has already morphed into the consumer. It's already happened, right? A good case in point was, Manish, in India, if you have, at least you have symptoms of COVID-19, you're supposed to refer to a number. There are helpline numbers for every state. And if the callback doesn't happen in 15, 20 minutes, there's absolute panic. There's irritation, because that's how much the consumer companies have spoiled us. Because we know when we go to them, we get an immediate response. And it's not that the government services are not working or the COVID services are not working. They're working, but they take time. And that lag is not good enough. And that is leading to poor patient experience. It's not that the patient experience is poor. It's pretty much the same. Healthcare providers are very surprised when they are rated poorly today, because they say we are giving you the same quality of service, but consumer has changed. And what that has led to, and this, I'm making a very bold statement out there because I'm going like full out, right? Whether it's in India or the US or UK, I mean, UK, I don't know, Europe is still government funded, so I'm assuming they're safe. But anywhere where private consumer healthcare exists today, or private providers of healthcare exist today, these providers will not exist 5 to 10 years from now. They simply will not have the bandwidth to match the new age providers who are already here, right? So a lot of the hospitals, they may not survive this onslaught. And COVID is just going to accelerate it. So the healthcare provider of tomorrow is going to be someone who has the ability to collect data, drive insights from the data, and use that data in his business process. And he or she may not be a hospital. It may not be a hospital. Today in India, hospitals and the government are the center for healthcare. Government will still remain for those who look for government services, who are below poverty line. But a lot of the hospitals will start disappearing. It's already happening. Hospitals are shutting down. They're getting acquired. There's a massive consolidation happening. And you have all these healthcare companies coming in. And these healthcare companies, CultFit is a good example, right? I don't endorse them, but I see what they're doing. They're collecting data. They're giving you treatment. They're doing telemedicine. They're giving you fitness. They know a lot about how your body works, what you eat, where you work out, how long you worked out. And they're using that insight. My own care provider will not know so much about me as much as CultFit does, because I'm a member too. And this is the threat that most hospitals don't see. They feel safe. And I'm telling you, post-COVID, I'm going to see in the next 5 to 10 years, you'll see a massive change, right? Cleveland Clinic, I mean, when I heard Trip, Cleveland Clinic once said that the hospital of tomorrow will be more like a NOC, where they're monitoring patients from remote, right? That's their vision. They don't see hospitals existing the way today. And I agree with them, because it's going to be palliative care, emergency care, surgeries will continue. Palliative care will continue. Emergency will continue. But most of the other patients will be monitored at home. And most healthcare providers in India are not ready for that paradigm. They still expect people to walk in, because the way they have designed their KPIs is all around bed, occupation of bed, average length of stay, average revenue per bed, et cetera, et cetera. So the patient has morphed into the consumer. He expects better services, and a lot of the providers are not ready to make that change. I hope that answered your question.
Definitely, Dr. Vikram. Thank you for providing the insight. And a couple of lot of key takeaways. A couple of it are like the spoiled customer behavior, like let's say behavior, spoiled customer need, and the data. And we all been knowing that data, like we've been hearing the phrase that data is the new oil. And I do understand, like when you said the data actually makes possible for this company to create that intimate relationship with the customer and to offer personalized offering. Now, I would like to bring in James to understand that how, what role this data can play in the healthcare industry. So, James, two-part question for you. I'm sorry, it could be like a bit lengthy question for you as well. So, first part is, can you shed light on how best the healthcare providers can leverage data to address issues of value-based cares, personalization, and interoperability as well? And with the competition intensifying, like as Vikram was also telling, that a lot of the current players might not exist. So what do you feel like how the incumbents or the new entrants, how they can use data to survive themselves?
Sure. So I think from my perspective, the most significant and exciting thing that's happening with digital health is that we're empowering sort of two entities with data that change the game. And the first and most important entity is the patient, right? So through these digital technologies, through the convergence of consumer health and health IT, we have the opportunity to deliver platforms and other sort of tools to a consumer base that, heretofore had sort of been sort of removed from what was traditionally health information technology. So that's exciting. And what that brings is more patient engagement, and patient engagement is where it's at in terms of healthcare in the grand scheme of things. And the second entity that's further engaged and also very important in the sort of achieving outcomes is the care team that needs to surround the patient and provide sort of seamless service. And that care team needs to be informed about both the patient's circumstances and more immediate, right? It can't just be a snapshot from month 1 to month 3. It's got to be using remote patient monitors and what have you. but also data that allows them to make strategic decisions about the person's care. So for me, I think the power of data that's sort of so relevant in this digital health piece is being able to empower both the patient and the care team, because it's not about just simply empowering the patient and their physician, solo physician. What digital health offers is the opportunity to surround a patient with a diverse group of specialists that can deliver their expertise in conjunction with a broader team. And that really changes the game, because within healthcare, it's extremely difficult for patients to navigate amongst those various specialists and get some unified sort of perspective on their care plan. So those are kind of the two areas that I would say are really exciting sort of post-COVID.
Sure, James, thank you for that. And so we all as Dr. Vikram and James mentioned, so a lot of these innovative companies like Amazon, Uber, Tesla. So we know that the reason they've been winning in this current in this digital economy, because they've been creating a different value to the customer with the help of technology. And we're currently living in accelerated times in which consumer behaviors is kind of rapidly evolving. So Trip, what we would like to understand from you, from your perspective and experience, that how digital is empowering incumbent as well as new entrants. And we know that using technologies, companies can create new values, they can innovate and develop new ecosystem that could fundamentally change care delivery. So from your perspective, how can care provider survive and exploit this current trend of digital economy?
Well, that's a great question, and thank you. Before I get started, I want to honor the people where you are in India right now. We are seeing this in real time. And I think as we talk about this, one of the things I try to do for my clients is put a face around what's going on. So I just wanted to make sure all of us understand the mission we've chosen to work on is that important. So I looked at it from a different point of view. Okay, I looked at it from the point of view of what's the biggest challenge in healthcare. And this is coming from some of my major clients like JP Morgan, Berkshire Hathaway. What happened? Why did they fail in their attempt to try to standardize this here? And so one of the thoughts I had was, the first thing is we have to redefine innovation. Okay, and healthcare is very siloed. I mean, you have 50 people in a meeting with 49 specialties and wonder how nothing gets done. And it reminded me a lot of my earlier career with Dr. Deming, where we were doing quality management back in the 90s with him and beyond, earlier than that. And one of the things I came up with is we have to think about this differently. And so I came up with a framework basically that works around the idea of design thinking. Because right now, some basic research, $15.3 billion funded healthcare last year, 1 year investment. Now, when you have that kind of money flowing into an industry, no matter how big it is, there's going to be a lot of waste. And if we waste the money, it doesn't come back the next year. So if you look at it, I came up with 3 I's for innovation. First one, interconnectedness. You know, how do all these things interconnect to each other, right? I think that's really critical to start thinking more and more about this. As we look at all this money being invested in all these little companies and big companies and large enterprises, we need to start interconnecting some of these dots. And they need people who can do that and can sit in the meetings with people and talk about these kind of things. The second is interrelated. How are all these disciplines interrelated to each other, and how do they relate to the consumer and patient? You know, the idea I'm getting surgery at the end of the month. It's 16 calls so far to prepare for that surgery. That's unacceptable by any other standard in the world. Third, the final thing I think we have to think about, because right now we're dealing with COVID, and it's very aggressive worldwide even now, but there's an element of this that I think we miss, and that's the impermanent nature of what we're talking about. So if you start thinking about this a little bit differently and have some innovative frameworks around this, I think we'll be in a different place. The second thing is we need to build standardized processes. We need to start adding audience research. We have to do the things that the consumer products companies do with their clients, because if we don't do that, ultimately the solution won't be found. It'll be all disparate. So if you look at audience research, empathic analysis, how often do you ever have anyone talk to you about what you're feeling as the patient? But more importantly, how often do you talk to the caregiver? Right? You have conversations with doctors and they have never been consulted about these processes they're being forced to use. We need to do situational and contextual analysis. Ideation, how do we do creativity in healthcare when there's a life involved? You know, one of the things I worked on the Watson project at IBM. And one of the things I talked about there was it's this ability to have a research assistant who never sleeps. So if you're a doctor, we need to train our doctors, the next generation, to use that. Problem framing. How do we solve problems? My framework of the world is strength-based, right? So how do we go and frame this? We keep looking for the sick. We keep looking at the problems versus let's see what can we do for the healthy. But why are certain people healthier than others? We need to shape the whole conversation differently. With billions of dollars pouring into this market and continues to pour in as baby boomers retire, if we do not learn how to control this and manage this, I understand leadership is important. But there's another part that we've left out a lot of times in the last 10 years, and that's the idea of managing a business process. Prototyping, how often do you see that? Many times. How often do we build along the way? How often do we go with the market with a finished product? How much did that cost us because we didn't talk to the customer or the patient or the other stakeholders in the conversation? And we have to get willing to be able to experiment again. And in this way, I think you take innovation to the different level. And then the second piece of this puzzle is starting to look at hard trends. You know, we know certain things. We know certain things about technology. We know certain things about demographics. And the third party that I think people miss most times, and I've had these conversations at the state level and at the federal level, is the idea of government regulation. The regulations in healthcare are probably woefully behind the times, and they strangle innovation. And they have people die because of this. Now, I know I feel like I'm the serious guy in the room, and if you knew me personally, you'd say, well, but the idea is this is really to the point of view of we have to start looking at hard trends. They're not going away. Multi-generational families are not going to go away. Technology costing less, 50% less every year is not going to go away. So when we design our equipment, let's look at some of these new realities. And finally, the one thing we haven't talked about, and I'm sure we'll hear about it in the next set of questions, is about how do we secure that data? The number one concern in the boardroom with my clients is the conversation about cybersecurity. But see, they don't talk about calling it cybersecurity though. And I want to say this because I think everyone on this panel will get this right away. They talk about risk management. It's a different conversation when you start to say, let's talk about the risk management factors we're opening ourselves up to versus cybersecurity. So that's my answer to your question, a very long answer, but thank you.
Thanks, Trip. And just changing the track a bit, talking about a success story. So we've been hearing a lot of statistics on digital transformation. That 1/3, mostly almost there's only one 1/3 success rate in digital transformation. So it's always going to be a good learning experience talking to those 30% of the companies who have successfully implemented digital transformation. So for that, we have Gary with us. And so Gary has successfully implemented digital transformation at Avio. So Gary, what we would like to understand from you is what was your motivation behind transforming your business using technology? And what was your secret sauce? What is that you would like to share with the audience as a secret sauce for successful implementation of digital transformation?
And it actually goes back to what Dr. Vikram said, and you all touched on it without saying the word, but it seems like everybody nowadays wants transparency. They want transparency in the process. You know, when you have that data that gives you information as to what is happening, whether it's with your healthcare, or for us, it's our service delivery for getting patients to and from their doctor's appointments. What we found out when we started was the client and the patient themselves both just got a phone call. They didn't know when their driver was going to show up, except that they knew, an approximate time. And as Dr. Vikram says, you've got Amazon that can tell you exactly where your package is. And we wanted to bring that to our service in our field and that technology. We knew Uber was able to do that as well. So one of the things that we wanted to make sure is we have that integration with Uber, and TechVent helped us with that with the API integration. That's absolutely seamless. But where we operate, where we have the biggest challenges is in the rural health markets, because our clients, they can get public transportation if they're in the major metropolitan areas, but they can't get that transportation out in the rural areas. So how do we bring that transparency to rural drivers? And we realized that we'll hire independents, we'll hire company cabs, and we developed an app with TechVent's help, obviously, that would track the drivers and the cab companies to bring that transparency to our clients and to the patients. So the amazing thing that we've done is there's nobody in the industry that is doing this that has the nation covered. We cover the whole United States, and we do that with our app and with our drivers, and are able to provide that service whether it's rural or metro areas. And other companies are out there, they do it, but they don't have that transparency. We can do turn-by-turn navigation. If the patient wants to know where their driver is, it's, Mr. Jones, we have your driver, Ms. Smith, coming up, and she's in a red Honda Accord, and she'll be there in 5 minutes. So it's that level of information that we've brought to the marketplace that has really propelled us forward. When we go and show our clients this transparency, the amount of data that they're able to see, they want to sign up right away. They're extremely excited about it, because the old technology didn't provide them much information. And I think the wave of the future, as you guys are talking about, it's that data and it's that information. It's absolute power at this point.
Sure. Thanks, Gary, for sharing that. So maybe we'll just take a 30-second pause. We'll do like a quick poll, and then we'll continue our discussion. So the poll should show up on your screen. So there are two questions to the poll, and you can just kind of quickly answer that. Dr. Kim, you're saying something? Okay, I saw the hand raised actually.
I just realized that you cannot answer the poll if you're a panelist.
Yep.
So I was just trying to point out that it's not working, and I read the fine print. That's too much fine print.
All right, yep. So we have the result with us. So I'll just let me kind of. So interestingly, majority in our audience, we have got people from health tech and startup. So it's pretty interesting. So okay, so without in the interest of time, I'll just continue our discussion. So maybe just a few quick questions for the panelists, and then would like to open it up for Q&A, because I see a lot of interesting points from the participants coming in. So starting with Trip, you first. I know that you've been doing a lot of work on rural health, and we realized that it's one thing which has been underserved. And it's been with the arrival of telehealth, it's kind of helping serve the rural health in an efficient way. So from your perspective, how serious the care provider should be about rural health? and what can they do to serve the rural market efficiently?
Well, that's a great question. I want to give you a couple numbers. If you guys don't know, probably I'm a numbers guy. Rural people living in rural America, there are 57 million people in rural America right now. Now that's a good number. Even that's, you know, if you talk about why would you build a market and why would you spend and invest time and capital in that, that number alone would probably get you involved. But here's a number, because we're in India today. There are 895 million people in rural India. Last year, the FCC in the United States spent $200 million on infrastructure improvements, $200 million. Telemedicine funding for last year, new telemedicine funding, $3.2 billion. This is a tremendous entrepreneurial opportunity in healthcare. This is a new market. This is a different market. It has different characteristics and qualities of the market. In this country, in the United States, this market has a lot of the challenges are going to be educational and change management. They're not going to be problems with the healthcare system because we will figure those out. But what the challenge is the patient. Now, you don't hear that from a lot of other people in healthcare, but you have to look and take that into account. I live in Amish country. You know, we talk about 2G as a high-speed connection, right? I mean, some of these numbers we're talking about, they're staggering. And there's such an opportunity to make a difference in the quality of life and the careers. If you look at the numbers of doctors in rural communities, there's 25% less doctors in rural communities. The patients are 40% more often are ill with more serious disease. The aging population is another dynamic that we have to take into account when looking at rural health, because rural health has an average age right now is about 67. What does a 67-year-old person look for within healthcare versus a 40-year-old person might be an urban person? And we need to start talking about these communities. We have access to data, we have information available, but we have to ask the right question. And that's one of the things a big part of my job is as an advisor and coach to executives is to get them to stop asking the questions they've always asked and start asking questions that will have impact. So as we're going to hear from everyone else today about everything else that's going on, but is 895 million people in India in rural health a good reason for us to look in investing and making the decisions to invest in that infrastructure? Because it's not one of the things we're moving into a world where healthcare can be anywhere. If you think about it, called healthcare anywhere, right? Over a reasonable amount of time within the next 3 years with mobile devices, there's nowhere you can't be. So now it's a matter of creating the right system. And that's what the challenge we have on this call and the people in the room. Thank you.
Yep. Thanks, Trip. And definitely healthcare can be anywhere. And we believe that could be the future of healthcare. And with that, to make that happen, going kind of little deeper into technology. So James, what you would like to understand from you, like in the next, is it really critical for the healthcare providers to transform their business with the help of technology in the next 5 years? If yes, what, in your perspective, what kind of technology could become critical in the transformation, like technologies like AR, VR, blockchain, AI, process automation? So what would be your take on like what technology and what could companies be doing in terms of technology for transformation?
Right. So I think from a provider standpoint, specifically a hospital standpoint, the thing that they have to be cognizant of is that there are big players, both on the payer sector, so for instance, Optum, that are making big moves, traditional sort of healthcare players that are making big moves, as well as big tech. And what that's doing is essentially cannibalizing the primary care sort of networks within the US health system. So for instance, the single largest employer of physicians is Optum. It's essentially sort of owned and operated with United Healthcare. So what it's creating and transforming is the traditional role of the various players in the ecosystem. So that's one, right? They're reinventing themselves. And then secondly, they're also adopting technologies, virtual care and telehealth and so on, that allow the US to build out a stronger primary care network. So if you were to compare the United States to, say, the UK, and compare the health systems, apart from sort of single payer versus sort of our model, probably the fundamental difference, and I've worked in both systems, is that we have a weak primary care system. And so what's really exciting about what digital health brings to the space is the ability to take this fragmented care that gets delivered outside of the traditional four walls of the hospital and bring that together and weave sort of a seamless experience for the patient, that precedes some of the larger expense that occurs at a hospital. And that's game changing, because what it does is it impacts both the patient and their experience, as well as it impacts the physician's experience. And as everyone probably knows on the call, physicians are going through enormous change, burnout, and so on. So they're looking for companies, apart from hospitals, that can change the way they work, because they want to spend more time on medicine and less time on paperwork. So there's a real attractive dynamic that's happening. And frankly, it's a market dynamic within healthcare that has been lacking in the prior decades, that I think is really exciting to sort of see into the future, is that these market forces are actually going to drive the change.
So, thanks, James. So, Vikram, so we've seen that healthcare has been one of the segment which is like highly regulated, opaque, maybe a bit of an unagile, and bit of an inefficiency in the system as well. So when the healthcare providers or the organizations, when they're taking their initial step towards digital transformation, do you think they should first envision or kind of exercise a digital reimagination of the business? And if yes, what would be a recommendation on envisioning digital to be more efficient?
Yeah, I think that's a great question. And I was just listening to James talk about the way healthcare is being delivered today, right? And he got it spot on, right? When we go through that entire ecosystem with the physician doing 10 different things, and he was referring to the US system, where a physician on an average gets about 15 to 17 minutes with a patient. In India, that number is 3 minutes, 52 seconds per patient. And imagine if you ask that physician to enter stuff into a very bad EMR, no matter which EMR you go to, it's always way worse than Facebook, right? And that's been a common comment I've gone from doctors, that if the technologists can design a Facebook, why did they design EMRs like this where you have to go screen by screen? So I think there is a heavy deal of reimagination to be done. And in India, one good example of where we can look at is another regulated industry, which has done very well in some of these aspects, and that is banking. Right? The Indian banking industry is heavily regulated, but in terms of technology adoption, it's miles ahead of many other countries. And the reason that we've been relatively successful there has been because of three reasons. Number one, we've had a very robust RBI mechanism, RBI along with NSE and BSE and all those regulatory bodies, they've been very proactive in going out there and setting the standards. So RBI has a standards for artificial intelligence. RBI has standards for machine learning. There are standards established for facial recognition, eKYC. Today, the way our digital banking system is running is primarily running because RBI went ahead and did those. Something that, in India, the Ministry of Health and Family Welfare, SEDESCO, all those lovely bodies that govern healthcare have not been able to do. We need an RBI equivalent of that because RBI sets the tone and the tone is set very high up. Number two, though we have struggled with a lot of technology adoption, but in banking, the amount of data democracy we've had is very high. If you look at the way the UPI system spread throughout the country, today I can buy something for 2 rupees or 3 rupees. That's equal to a few cents for my friends from the US through a mobile API, which is available for every bank. I have a UPI number not only for my bank, my personal account, but also for my business account. And that has really changed the way transactions are being done in India. Right? So I think that has been a big advantage to us. And that advantage has to spread to healthcare because the data, the democracy that has come into banking, if it spreads to healthcare, it changes the game completely. Number three, I'm really looking forward to OCEN, which is the Open Credit Network. And all of this has been brought about by the India Stack, right? India Stack has been a body that's been working along with, under the aegis of iSpirit, where they've been working constantly in creating an ecosystem by which I can share my credit data. And I have the right to revoke it. So all those questions on privacy and who owns the data, is it my data, is it your data, kind of goes away. If the OCEN system is brought into the healthcare system, and the India Stack is working on it, and somebody just mentioned about the National Digital Health Mission, I think that will enable the patient to give access to his data as he requires to a provider and pull it back out. And that will create an ecosystem where, back to my first point, where in 5 to 10 years, a lot of these organizations won't exist because they have no control over your data. The patient controls his data, the consumer controls his data. He can give it to anybody. He can give it to anybody and get treated anywhere, anytime. And when I talk about anytime, anywhere, I'm talking about a telemedicine system that is able to integrate your records into a longitudinal patient form. And hence usher in the era of EHRs, which is an unspoken thing in India. Right now, we are still debating HIS and HIS thereofs. We have not even gone to EMR, but I'm talking about EHR now. So I think there is a lot of transparency that will be brought in. It's just a matter of time. Luckily in India, we've not invested in very expensive healthcare infrastructure. So that means in a way, we don't need to. We can straight away ditch, like how we did. A lot of people in India have never seen desktops or laptops, right? All they've seen is a smartphone. And they transact digitally over smartphones. I don't think a lot of us will see the traditional EMR, EHRs taking shape. We will probably go directly to an OCEN network with obviously the right protocols for privacy and security. And the one thing that I want the government to do, though they've done a lot of it, and they should take cue from governments in the US and especially Europe, is establish the standards first. We've had a draft data privacy bill in discussion for, I think, almost 3 years. We've had a DISHA, Digital Information Security for Healthcare Act, in discussion for 3 years. These have to be tabled and passed. I think they're very important. I think COVID has again, impacted us further on that, but these are important regulations that need to be passed, and we need an equivalent of an RBI in healthcare in India. I think that will really change the game for us.
Thanks, Dr. Vikram. Very important point, and a lot to learn from it. And definitely, we've seen the way financial industry has changed in India, and we're definitely looking forward to similar thing happening across the world in healthcare as well. So with that, we're almost coming towards the end of discussion. Maybe we'll just do, so Mansi will just take 15 seconds to do a quick poll, and then we'll request each of the panelists to share their closing remarks, and then we'll take a few Q&A. So maybe like while people are like putting in the poll data, maybe I'll request, I'd like to request each of the panel member to share their closing remarks, to take away point, like to take home points for us, which could give us enough thoughts, food for thoughts to think about future. So maybe we'll start with Trip first.
I think what I would point out and what we've heard today is a lot of this is going to come down to helping people be better at what they do and change the system that exists. We have to break down this system. Every part of what we talked about, Dr. Vikram talked about all these component pieces. And you look at the United States and you look at a lot of things and deregulation and those kinds of issues we have to be more proactive in breaking down the systems that exist today with an eye towards the future. And if we can use the word I would use would be leapfrog to the next generation. Don't invest so much money in systems that don't work to have a stopgap measure. And it seems like everybody in this room seems to have that same idea, but it's about the people. You know, everything we talked about today was about people. There was very little talk about technology. And I think that's the other part that I'd leave with. We have to continue this conversation on those issues because those are the issues that break down. Thank you.
Sure. Thanks, Trip. James?
Yeah, I think the two takeaways that I want to share that people on the sort of call would find really interesting going forward. And the first is kind of answering a question you asked earlier, which is what technology is really sort of pivotal in this space. And I would say actually to that question, I'd say really the platform is, and it's a group of technologies, is the thing, right? So in other industries, obviously we've seen platforms play a huge role. I think increasingly in the next decade, a platform is going to have an enormous, a platform approach is going to have an enormous implication in healthcare. You see that in all sorts of places like Cerner partnering with Amazon to convert what they traditionally called an EHR into a platform, numerous other instances where the platform approach is applied. The second takeaway I'd share is that I think there's a lot of power in approaching this whole space using design thinking. I know that's sort of cliche and often overused, but the difference that I would sort of say in that thinking and reframing is when you think about sort of traditional healthcare today, a lot of it's using swim lane diagrams and other sort of systems that are kind of within an existing system. Design thinking allows you to shift to be patient first centered and use journey maps and other sorts of things that are very much part of delivering apps and those technologies that aren't being used today in sort of healthcare to the degree that they need. So two takeaways would be platforms and design thinking and patient first, patient first.
Thanks, Trip. Dr. Vikram?
Yeah, I would like, at least those who are listening, I want them to, it's kind of cliched again, but the healthcare system, especially globally as well, the amount of money that's being spent on it can only fix you that much. I think while there's a lot of concern about my data and privacy and all these wonderful things, I think the important thing is to, take charge of your health. I think a lot of folks use technology personally. I think the healthcare system overall is broken and it needs time to be fixed. But at the same time, a lot of responsibility have to be taken up by individuals, taking care of themselves, taking care of their records, adhering to protocols. At the same time, healthcare providers need to start thinking slightly differently. Change their KPIs from average length of stay, average revenue per bed, to trying to figure out how do I improve the health of the community and find out a business model that gets you paid for keeping people out of the hospital. I think that's feasible. There have been a lot of instances. NHS follows such a model, and it obviously works out because it's the government's money that gets spent on the care there. So I think such models are feasible. If the healthcare providers don't do it themselves, then there are other organizations who are more than willing to step into the void. James, I think, spoke about Optum, and the work that Optum is doing, and Optum is doing a phenomenal job. I had the fortune of working with UHG some time ago, and I could see what they were up to. And that's going to happen in India as well. So healthcare providers need to be very paranoid. We don't want a Kodak moment here, right? We don't want Nokia. We don't want Motorola. You don't want to go down that path, because you will go down that path if you don't pay attention. The consumer is demanding better services, and the consumer today is willing to pay to stay out of a hospital, as long as you have something to provide him at the quality that Amazon and all those wonderful things have spoiled us with. That's number one. And number two, the other thing I want to leave them with is, I think the government has to find a way to establish the standards. I think that's the government's job. I think today government is doing a lot of things, trying to run healthcare, trying to fix primary care system, trying to run district hospitals, run quaternary care centers. I think it's doing a bit of a lot. I think if they fix the standards, I think the private healthcare system can take care of it. And the data democracy that's going to come in is going to ensure that there's no off balance in the business side. There is money to be made here, and healthcare is a good business. The only thing we need is standards. We need democracy of data, and to a great extent, we need individuals to demand better care. And those three will come together soon.
Yeah, Dr. Vikram, and definitely healthcare is a good business, and at the same time, it's a good service due to humanity as well. And that's what we've been seeing in the current pandemic times. It's just a good combination of both. So, Gary, I'd like to hear from you as well.
Today is a very interesting talk. I really appreciate being part of this panel. The one thing that Dr. Vikram said that I would love from the United States standpoint is the ability to be in control of my own medical data. I think that would be huge, because right now you're not. It goes to the hospitals, it goes to the doctors. If we had a method, much like the banking system, where you had a card that you could share your data with the doctor and then pull it back when he was done, that would be phenomenal. It's incredibly enlightening. I love that idea.
Thanks, Gary. So maybe we're like almost at the end of hour. So maybe we'll just take one question from the audience, and then what we'll do, though, we have like a couple of questions coming in from the audience. So we will get these questions answered by the panelists, and we'll be sharing the response with the participants. So the one question which I would like to take here is, like we've been talking about telehealth and advancements in telehealth. So what's the scope in any telehealth domain? What's the scope for a startup versus big player? And maybe Trip, you would like to take that one?
I think it's an interesting question, because I think telehealth has provided us with an interesting innovation opportunity, both in big and small, and an opportunity to partner. One of the things we didn't talk a lot about today, but I would bet every panelist would believe that a lot of the success that will come in the future will be through partnerships. No one can afford just the one-stop solution. So if you look at telehealth and where the big opportunities are, you look at some of these large telecom companies who are climbing into that space aggressively and providing the platforms there for growth and development. You look at a lot of the data companies doing the same thing. Telehealth will evolve very quickly, simply because the market is already there demanding it. And part of our job in this panel and the people in this room are to help that conversation happen and make sure that people know and get involved in that. So I would call forth everybody in this room kind of to take charge of that piece of it, because there's already $4 billion being invested in it. And that number is going to go up, I believe, for the next several years, specifically because a large portion of the population can be served in this way better. It's not only it's cheaper, which is okay, I don't have a problem with that, but it's a better form of healthcare for most people who are getting it that are not getting it now. And that's a great solution for everybody. Thank you.
Thanks, Trip. And so with this, I would like to express thank you on behalf of everyone present here, and my deepest gratitude to all of you for this amazing discussion and sharing your insights with us. It's been, we have kind of learned a lot in this discussion, and lot of points to take home, a lot of points to think about, and definitely a lot of future values that can be created out of this discussion. So once again, thank you all panel member for taking out time and sharing your experience, sharing your insight with us. And thank you all participants for being with us today. So just two more points for the participants. So if anyone in the participant, if they need any kind of technology consultation or any kind of like exploration they would like to do in terms of technology, we'll be happy to provide a free technology consultation to you. And as a token of gratitude from our side, we'll be emailing you a digital transformation action book, which we have been drafted in consultation with experts in this digital transformation and healthcare vertical, and which could serve as an initial guiding document to begin your own technology or digital transformation journey. So once again, thank you, all of you, and wish you a good, stay safe, and wish you good rest of the day and rest of the evening to all of you.